All right, we are going live. So we're going to do our quick audio checks, make sure we are good. And then we will get started in just a few minutes. Super late night streaming on a Monday. In the meantime, hope everyone's having a good Monday. I had a pretty good Monday. Make sure we are good. There we go. So audio sounds great. It is 10 p.m. over here, 10:30 p.m. on a Monday night. It's a late live streaming day because these daily live streams actually are taking a toll already, and we're only on like the first week. Anyways, we're gonna jump right into it. These are my working sessions for those who may be new that are joining, where I'm just basically creating a study guide for the upcoming AMIA AHIC certification exam that I plan to take in about 2 or 3 months, probably 3 months. But daily working sessions where I'm just trying to figure out what kind of questions they're trying to ask based on the outline topics that they have provided. So for today's live stream, I'm going to cover sections 10 and section 11. Section 10 is policies and procedures for data sharing across systems, health information exchanges, and public health reporting. And then section 11 is interoperability of information systems, including technical and non-technical approaches to facilitate access to data. So it's a lot. I think this is starting to get into the more fun stuff that I really enjoy. And hopefully I don't spend too much time on it because there's a lot of things we can talk about. But let's go ahead and get started. So policies and procedures for data sharing across systems. So the first thing I'm like wondering about is like, it's definitely not institutional policies because, you know, that's specific to the institution, but maybe just in general what policies may look like. So like one that I can think of right off the bat is like opt-in or opt-out for health information exchanges. You know, that's one, and I think that's usually like a statewide type policy. Public health reporting, maybe they're talking about federal policies, but let's just take a look. So usually I just start off with, you know, policies and procedures. Literally just Google it, see what may be out there from a Google search. Yeah, that's probably a lot. So what was the thing about again? Policies and procedures. I don't think I need this. Let me move this away. For data sharing across systems. Yeah, we can probably cover different types of policies. Federal policy to state policy to different institutional policies like NIH data sharing ones. Let's start off with the first school one. Data management and sharing policy, the first step towards promoting data sharing. Let's see. Health-related research funders, regulators, and journals expect that de-identified individual level health data be shared widely with as few restrictions as possible, yet in reality, the volume of shared data remains low. Health researchers and other data producers, blah, blah, blah. We argue that having an institutional department or group data sharing, management, and sharing policy is the first step towards encouraging researchers and healthcare professionals to share their data more widely. Our paper outlines the elements of data sharing and sharing policy, which should include aims consistent with those of the institution as well with the data management procedures, models of data sharing, request procedures, consent models, and cost recovery mechanisms. A policy would help an institution, department, or group maximize the use of its data and protect the interests of its institution and its members. Base our recommendations on our experience collecting and curating data for large clinical trials conducted in low and middle income countries, facilitating the sharing of data sets with secondary users, whilst teaching data management and conducting empirical research on data sharing. Although the fundamentals of a policy are general, the paper is focused on the low and middle income country context. This is very interesting. Let's see if there's anything to engage. So policy and procedures for data sharing. So this is probably like pretty decent. This is like almost like a background information, even though it's like low income. What's the full wording again? Low and middle income countries. So Data management for data sharing, models of data sharing. Consider different models of making data available to secondary users, online open access. And this is fascinating. Data access criteria. Data sharing policy should provide guidelines within constraints of funders on which specific conditions access should be put in place. This include recognition requirements such as authorships, acknowledgements, or standard citations. Consent models, budgeting, and cost recovery. Typically, data sharing is not designed to generate profit, but rather to share the actual cost between the secondary and primary researchers. The cost to be taken into consideration may include time spent on activity, specifically data sharing, such as curating data for sharing, as well as time spent by DAC members in reviewing data requests, by institutional lawyers where the shared data has legal implications or general administrative expenses. We outlined the elements of a data sharing management data for responsible data sharing. We argue that having a policy is the first step to encourage researchers to share. Data Access Committee. This is fantastic. This is like a great background article. Basics in data sharing. Let's go ahead and cite this. I think what I'm trying to do also is to link here so there's easier access, but at the same time also supply the appropriate reference formally. So data management. What happened to my thing? What was it called again? Basic. Oh. Background. So what I'm gonna do is I'm literally just gonna copy this whole thing. This is like fantastic. No, it did not unbold. Perfect. Okay. Let's go ahead and find a bit more bolding here. Models of sharing. Names. Okay. So background and basics. This is good for that. Okay, let's see if there's something else. NIH data sharing policies. So this table lists data sharing policies in effect at NIH. It includes policies at the AHIC division and program levels that apply to broad sets of investigators and data. Individual requests for applications and program announcements may specify other requirements or expectations for data sharing that apply to specific projects. IC. What does IC stand for? And why do you not have a like it's really frustrating when people use acronyms without specifying. Includes policies at the NIH-IC division and program levels. Like, what does IC mean? Do you have a hover? Is it like interest to organization or something? That's a little name and repository. And code. I'm trying to see if they show like a definition here. I don't see it. So it says encode consortia data release data use and publication policies. Projects resource to sellers access to use of data for the entire scientific data. So data sharing policy. So requires resource producers to release primary data along with an initial interpretation in the form of genome features to the appropriate public databases as soon as the data is verified. Consortium members will also identify validation standards that will be applied in subsequent analysis of the data or additional experimentation where appropriate. It's very interesting. This is like probably a great example of like different data sharing policies. NIDA. So the thing again here was, I think, policies and procedures for data sharing across health systems. We might be getting a little off on a tangent. The background's great, but I don't think they're probably going to look too much into this, so I'm not going to go too deep. So I'm just going to show an example. NIH data sharing policies. Probably just good information to know, but I think what the AMIA AHIC exam is probably going to test on more is like those that pertain, what I said in the beginning, like health information exchanges, state level, and then regulatory policies that impact data sharing. So this one, NIH data, let me like be a little bit more targeted in that. Oops, I did not cite it. Cite. Oh. Okay. Got a link. Put that there. It's like health information. Let's do like the actual stuff. So it's like health information exchange, and then it's what's the other one? Public health reporting. Health reporting. So let's take a look at health information, data sharing, policies and procedures, health information exchange. Nice. There's a nice article on this. Very nice. Okay. This AHIMA is always a good resource. So let's actually read this. So policy and procedure considerations for health information organizations. Policies and procedures govern the operations of the health information exchange, and many factors must be taken into consideration during their development or revision. They set expectations for the workforce, delineate staff training and accountability, and must be part of ongoing education and compliance program enforced by leadership. A health information organization, HIO, is defined by the National Alliance for Health Information Technology as an organization that supports, oversees, or governs the exchange of health information among organizations according to nationally recognized standards. Ensuring compliance can be a daunting task, especially related to HIO participation agreement requirements and federal and state laws of corresponding and existing policies and procedures. Okay, I need to look for data sharing. Nope. That allows to share PHI. No, actually, this might not be a patient consent. What exactly is this? These are just like policy and procedure considerations. When developing policy and procedures for health information rights, this was not replacement for seeking legal counsel. Healthcare providers may participate in exchange of protected either internally within. Oh, this is like decent. Let me see, policies and procedures. Be good to cite, but this wasn't what I was thinking of in terms of policies and procedures. Review existing policies and procedures. revise participation agreements to reflect AHIMA's information governance principles, establish HIPAA structure for provider relations, review compliance processes, manage patient consent, manage access to PHI, provide a standardized consent form to all data sharing partners for consistency. Ensure that the consumer consent form is written with varied literacy levels in mind. Above all, a collaborative relationship between HIM professionals and clinical administrative stakeholders is paramount. Equally important is knowing where to start. Developing HIE policies and procedures. Whoa. That was loud. There's apparently a flood warning. Equally important is knowing where to start. Developing begins with a solid review of what you have to work with, identification of where changes or clarifications need to be made, and then making the necessary changes. And this is probably a really good resource. And to be honest, this might be like what they're looking for. These are like the different considerations. And then the topic again was what? Policies and procedures for data sharing across systems. So considerations for policies and procedures by AHIMA for HIEs. Let's go ahead and cite this. Copy. Link. Cite. Policy and procedure. Oops. Yeah. I don't even know if that's the right one. Procedure. Oh, yeah, I got rid of it. So, considerations. HIEs from AHIMA. Okay. Go ahead and copy and paste this again. Maybe it's fine. Let me see if I can do those main things. So, review existing policies and procedures. Revise participation to reflect AHIMA's information and governance principles for healthcare. Establish infrastructure for provider relations. I mean, these are all like very common sense things, you know? But maybe some things you just don't think about because there's so many things to consider. Common sense, yes, but there are a lot of nuances in doing this type of work, so good to list these out. Other considerations. I might keep it at this for now, you know. And then look at the federal policy afterwards. Or actually, I might just go ahead and take a look at the opt-in, opt-out, because that's in the classes that I've taken in the past, that's always like a big policy move on whether or not HIEs should be opt-in or opt-out. And the problem is that it differs, and that level of differing makes it very inconsistent, you know, in terms of like how complete data sets are, or how complete data sets within each state HIE is. So I think that's a really important thing to note if folks aren't aware of opt-in, opt-out, and they just use HIE data as is without knowing that kind of stuff. It's good to know those limitations. All right, number 3. All right. And then the last one, which is quite a bit. Okay. I think we're good here. All right, well, again, let me look at one more thing, which would be, oops, why did it do that? Not this piece, it is considerations, and then this one would be opt-in versus opt-out policies. Opt-in, opt-out health information exchange policies. Nice. There is multiple articles on it. So there's 2020. Let's look at this one first. State HIE consent policies. Provides a 50-state plus the DC comparative overview of patient consent policies enacted either through legislation or agency guidance that may govern health information exchanges operating each state. The table below presents the following information: type of consent policy, source of consent policy, state involvement in generating the consent policy, statewide applicability, scope of consent, and details about consent. Yeah, this is perfect. It doesn't. Does it go into any of these? No, unfortunately not. I was hoping it would talk more about like what it is. So I think this is very useful in referencing. Let me reference this. Good to know. A little outdated, but that's all right. State HIE opt-in versus opt-out policies. 2016. For every state and territory in the US. Opt-in state HIE. Did it not cite state HIE? State. Oh. Strange. State. It's right here. Why is it not saving? It's a little annoying. I'm getting like an insane amount of text right now, just like non-stop. Information exchange. This is very frustrating that it's not going in. You can turn off like these notifications. They are extremely annoying. There we go. I'm trying to do work. People keep bothering you. All right, this is not One second, guys. Sorry about that. Distractions don't really help me out. All right. Let's see. All right, this is not FIT, gov. This is not working either. It's like late and I'm getting just like slightly frustrated. This study guide is getting quite long. Oops, let's go back up here. Let's try this one more time. All right, doesn't seem like anything is going my way today. So we're just gonna do the links instead. Let's go find an article that explains this. There's a nice 2020 article, looks like. No, that's not what we'll do. Exchange driven. Christopher Jason. There's a lot of great articles that he writes. I follow him a lot on the different things he does. So let's read this. Administrators working in states requiring opt-in consent for health information exchanges carry greater burden than those working in states with singular opt-out policies. However, hospitals that are technically less advanced than others also express higher levels of administrative burden, according to a study in the AJMC. With HIEs becoming more prevalent across the country, consent policies are a main focus for administrators and patients. States with opt-in policies, which require the patients to explicitly give permission for her data to be included in the HIE, usually prioritize patient privacy. Meanwhile, opt-out policies require patients to specifically request their data not be included in the HIE, meaning they ensure high patient participation in HIEs. These policies carry positives and negatives for patients, and they also have a major impact on administrative burden. Using data from CMS's Promoting Interoperability program in 2016, the AHA Annual Survey and the AHA Annual Survey Information Technology Supplement for 2016, researchers examined the relationship between consent policies and hospitals experiencing barriers to HIE. 34 states had HIE consent policies, 7 of which were opt-in policies, 15 were opt-out policies, and 12 states had policies that were not defined. Of the 1135 hospitals that had opt-in or opt-out policies, 478 were from opt-in states, while 783 hospitals carried an opt-out policy. That's kind of good and bad. There's more opt-out than what, so you expect to get more data than less. After examining the data, the team found that the states with opt-in policies were 7.8% more likely to experience regulatory barriers to HIE. These findings that suggest that opt-in policies may uniquely contribute to hospital barriers to HIE compared with opt-out policies. The researchers wrote in the report, given the administrative burden that opt-in consent policies introduce, our findings are consistent with the larger power of work supporting the claim that opt-in policies are more burdensome to implement. However, policies requiring explicit content such as these may serve as an important protective role in the use of patient health information. However, there may be a silver lining for administrators who work in hospitals with opt-in policies. Teams found that hospitals with opt-in policies may be able to reduce administrative burden if the hospital is up to a high technological standard and HIE capabilities. There was a similar correlation between opt-ins, technological sophistication, and the impact of both on admin burden. On the other hand, the team also said that opt-in consent policies may further delay these hospitals in achieving interoperable HIE. That is to say that although opt-in consent policies may contribute to a variety of administrative or technical barriers, organizations are able to overcome these barriers if and when interoperable data exchange becomes an important institutional goal. Our findings fit with other work finding that both incentives and hospital technical capabilities relate to HIE volume. Although opt-in policies result in less administrative burden than opt-in policies, for some reason I thought it would have been counterintuitive, but I guess like you have to opt out to not data share. So I guess in that sense, it makes sense that there would be less. Opt-outs tend to raise concern among patients regarding rights and patient choice. On the other hand, opt-ins prioritize patient preference and privacy. Yet it requires more work for administrators and clinicians. That makes sense then. In the case of opt-in consent policies, states may choose to prioritize patient privacy, right to consent, and patient preferences at the cost of added administrative burden and regulatory hurdles for hospitals and providers. Policymakers should consider the existing legal structures related to HIEs in their regions and the technical capabilities of hospitals in their states to anticipate the burden that opt-in consent policies are likely to bring. Furthermore, federal policymakers tasked with reducing administrative burden related to the use of EHRs should consider that hospitals at varying levels of technological sophistication may experience different administrative burdens. Very interesting. I think this was the other article that I looked at, right? Yeah. So states with opt-in policies were more likely to experience regulatory HIE barriers. That's fascinating. Super fascinating. I mean, I think I think opt-in versus opt-out is a very important thing that will probably more than likely be tested on this exam. I think it's a pretty important concept as we facilitate a world. Of course, my citation stuff is not working. It's a little frustrating. Let me try restarting this because I would really like to cite this appropriately. Bear with me for a second. So Stero, nice. I don't think I even cited it yet. Opt out. Opt. Yeah. Cited. Copy this. Nice. Go ahead and link. And then do this opt-in consent policies. Go ahead and cite this one too. Opt-in barriers. Where's the barriers? There it is. Great reading material. I really wish I had more time because I would love to read more into this, which, eventually when I study for the exam more in depth, I'll get to this. I'll definitely read this. Definitely important to know. All right, we gotta move on because I'm spending a little too much time on this. We're at 33 minutes. So I think that's probably a good majority of HIEs. If you read through this, I think that would be pretty sufficient for this section. Let's move on to policies for public health reporting. Policies and procedures for data sharing, public health reporting. It's probably going to be, WHO data sharing policy. WHO policy on the use and sharing of data collected by WHO member states outside the context of public health emergencies. This policy applies to the use and sharing of data collected by WHO in or who provide to by member states outside the context of public health emergencies. The policy allows or places no obligation on WHO or member states to collect, anonymize, analyze, or share other health data than those already being collected. data sharing policy in context of corporate health emergency. Go ahead and cite this. Just an example. Data policy. Whew. Spending more time referencing this together. Hopefully, you know, at the very end, we're gonna have a very curated study guide for folks to use when studying for this exam. So let me look at something else. Public health reporting, data sharing. Let's look at this. Standards to facilitate data sharing and use of surveillance data for public health. This is probably perfect for this. Following standards are based on the 10 guiding principles for data collection, storage, sharing, and use. They represent recommended standards to ensure the security, confidentiality, and appropriate use, including sharing of data collected by funded programs. These are just like sharing and agreements. Public health reporting. Yeah, I think I'm gonna do this and then move on to the next stuff. What is this? National Center for HIV, Viral Hepatitis, STD, and TB Prevention. It's a very long thing. Standards to facilitate data collection. That's probably good to know. 10 guiding principles from CDC. From CDC. Let's go ahead and cite this. Copy. Link. Insert. 10 guiding principles. Facilitate, okay. That's good. I don't know why it does that. Did I cite this already? Standards to facilitate, okay. Standards to facilitate. All right, and maybe we'll just copy some of those in. Probably copy both of those would be very useful. Copy this. Link. Go ahead and go to the 10 guiding principles. Oops. This. Paste without formatting. Copy and paste. Copy the 10 guiding principles. Okay. Move back here. Go ahead. Ooh, it is storming outside. Collection use. Okay, there's a couple of them. So this is from NCHHSTP. Of course, so like my thing is on the wrong thing. NCHHSTP. Program policies and responsibilities. Data collection and use, data sharing and release, close security, electronic Data security. Policies and responsibilities. I guess I did want to bold them. This is number 1. Oops. Just come on. I feel like I should read into these a little bit more, but I'm never gonna get through all this content if I like literally study for each one of these. I think just putting together the study guide, you know, like what I'm doing right now, well, it's helpful. You know, you kind of like get an idea of more of the details of what they may be testing on, you know, what they may be going after, at least what I think they may be going after. Data sharing and release. Okay, physical security. Yeah, I don't think like, even if I like look through all this stuff right now, I probably wouldn't be able to like remember it. And again, a lot of this is common sense, so looking through this later on, like you should know this stuff anyways. At least consider it. Have thought about it. Oops. Paste without formatting. Okay. All right, I think that should do it for this section. I think we have a good enough amount right here. Let's go ahead and move on to the next section, which is interoperability of information systems, including technical and non-technical approaches. So let's see. It's quite vague and wide open to like what they're looking for. So maybe I'll see if there's a way to split this up into technical and non-technical approaches. So just ways to facilitate data. And I think like standards, you know, off the top of my head, things that would be like health information standards, right? Standards, standard development organizations, SDOs. Regulation, federal regulation, to facilitate access to data, federal regulation, data sharing policies and just things like this, federal regulation, and incentives, probably things like this. These would be some of the things I'm thinking about. So interoperability, let me again start off with a Google search. Let's see what may come up first. Approaches, okay. You have standards development, types of standards, content, transport, privacy. This is probably pretty solid. Like standards on their own, testing and conformance, increase adoption of emerging mature. This is probably like a solid, you know, HIMSS is always a good website to reference. Talks quite a bit about this. This is probably all helpful information, good review material anyways. So interoperability in healthcare. I could probably get rid of my things here that seems to cover no, I probably don't need to do that. Yeah, I cited this already, interoperability in healthcare, so we do Sotero. Healthcare. Okay. Copy and paste this. And let me actually start citing some of this. what is interoperability? Four levels of interoperability. What is health information exchange and data sharing? Look at these standards. This really is a good amount. Four levels of interoperability. I don't usually think of the four levels of interoperability when I think about interoperability. A very good, like, basic background on all of this. Okay. I think what I'm gonna need to do is actually standards development, types of standards, vocabulary, standards, content standards, transport standards, privacy and security standards, fire standards, intent to fire, certification guides and profiles. Ooh, this is perfect. They even cover the technical and non-technical stuff, so this is, you know, copying this entire thing is probably fine. Like this probably covers the majority of things that will be asked in this section, and then maybe expand on some of these pieces as I read through it later. Architectures, centralized, federated, hybrid. If you're wondering why I'm typing all this out, is like the formatting. Like I'm a little type A with the formatting. And just copy and pasting isn't really like great. Environmental scan works enabling exchange. Wow, there is a lot of stuff in here. You know what? Give me like a minute or two. I'm gonna come right back to this. Be right back. All right, let's continue on. Yeah, this is like really good stuff. So let me continue with this operational. Where is this? Public policy. Exchange. Oh, because this is like the hymn stuff. This is super awesome. This is like a very nice. Yeah, this is what you can't do that. Very, very nice overview of all this stuff. There's so much information. Okay. Ensuring privacy and security. Okay. Using card data. I'm taking the time to actually copy and paste all of this in there because I think this is like important enough that everyone should be reviewing. And here we go. This is like other good stuff. Public policy and government efforts. It's all super awesome information. I'm surprised I like never read this stuff. This is like fantastic. Initiatives. Here's key position. Yeah, this all falls under interoperability. So then there is interoperability standards advisory. Say. Okay. Advancing standards for precision medicine. State-level interoperability initiatives. Oh, nice. Now they go into like international ones. So what do we have? So this is like United States, so one more above. global governmental policies and initiatives. Oops. I think that's it. Yep, that was it. This is the last bit. All fantastic stuff. Be patient. Let's make sure the formatting's okay here. Okay, this looks good. Oh, I forgot I need to go back and like copy and paste all this other stuff. Let's go. Start doing that. So we have standards development. Or yeah, standards development. I should probably make flashcards for all these. You know, eventually, once all this is compiled, and I review all of the content, perhaps instead of the outline, it's just creating flashcards and study guides and things like that to help with this kind of studying. Because this is pretty tough to process. This is going to get very lengthy. Why is this not bolded? Okay. Oh, this is one of them. Okay. Vocabulary standards. Standards. Sorry guys, in the live stream, I'm just like literally just compiling this, trying to focus. Okay, transport standards. Hopefully this is going to all pay off at the very end. We have a lot of content. All of these standards I had to learn too in my classes. It's all like good information. Okay. Know about identifier standards. All right. So copy this. Testing conformance efforts. All this stuff back. Okay. Almost there. I'm like past the live stream right now. Network architectures, extreme partners, and social determinants. This. Okay. Types of AHIC organizations. Oops. Uses. Okay, I think we are done with all this. So what I'm going to do is go ahead and go to the top. Where are we at? This is like a book in itself. Okay, so we're all cited and we're good. I think we're going to leave it at that. I think that this should do a pretty good job of doing it. I think maybe I might be missing. So it's including technical and non-technical approaches. So both are included in here. Yeah, actually no. I think this should be the vast majority of what would be tested in this section. And that is fine. So we've covered both of those sections. I'm a little behind in my schedule right now, but that's it for that last section. Policies and procedures. So that was section 11. Should have been doing these two today. So I'm going to catch up. I'll probably play catch up eventually, but that's it, guys. Thank you guys for tuning in. This went a little, actually no, this was exactly like 3 minutes over. Thank you guys for tuning in. Hope you guys enjoyed. See you guys tomorrow. Bye.